My name is Charlotte Owens, and I'm a medical director at AbbVie. My particular emphasis is in women's health, and we're trying to solve problems that are related to conditions that exclusively affect women throughout the life cycle of their lives. For me, women's health allowed me an opportunity to do a few things because I believe when a woman is healthy, she can make life decisions that are also equally as good as her health. As an obstetrician gynecologist, I've dedicated my life to improving the lives of women, and I have the opportunity to work within my specialty. I've been working on a trial that is for a product that disproportionately affects African American women and other women of color, and therefore it was important that they were in the trial. It was important that they're in the trial not only because they're affected by the disease, but also because in those populations, very frequently they have a higher burden of symptoms and a higher burden of disease. When you look at how many people have a particular disease, the participation in the clinical trial should be proportional to the prevalence that they have that disease. In some areas, that means that racial and ethnic minorities may be left out for many reasons. One is that there are system issues. Do you place the clinical trial in a place where minorities get their care? Number two, what is the investigator, what is the provider makeup? Do you have providers that take care of minorities? The third is the patient and their family. A lot of minorities know about trials where minorities weren't treated appropriately in the clinical trial. So there's a history of clinical trials. There's also some lack of trust because of the knowledge of that history. They may be underinsured or have no insurance. And this means if they have a health condition, what we call comorbidities, that prevent them from being as healthy as they could be, they're not even eligible for a clinical trial sometimes. But what was more important to me was to make sure that not only that the women came into the study, but because we were running a study that was more than 2 years, keeping them in the study was also important. And the way that we were able to keep them in the study was by listening to them and understanding what would make their participation in the study easier. And to see that come to fruition, that's like the perfect plan come true. At AbbVie, we have teams that are actually looking at this on a daily basis. They're exploring ways to help make trials more patient-centered, to help make trials more efficient, to help reduce the burden of trials on patients. We're really focused on thinking out of the box, thinking beyond today, thinking into the future, and really trying to find a way to create a better tomorrow.